The commercial city of Lagos has become the epicenter of the coronavirus outbreak in Nigeria as the country continues to witness a rapid increase in new infections. Authorities have expressed their concern over the alarming situation, with the country said to be dealing with a COVID-19 variant similar to the one in the United Kingdom. The West African country is expecting COVID-19 vaccines in January, while outlining measures to contain the virus. Here are more details of that.
Nigeria recorded its highest infection rate in a single week to date this past week. Authorities are calling it the country's worst period since the outbreak of the virus.
Our TPR analysis shows that 16 out of every 100 tests carried out are positive. We are also seeing increasing transmission among younger people.
Our treatment centers are filling up. We're struggling to keep up. We're struggling to find the facilities to manage, the oxygen to manage. Every night we're faced with phone calls of patients desperate for care.
Infections began climbing in December, leading authorities to declare a second wave of the pandemic. Health authorities suspect a new variant of the virus detected in the UK could be partly responsible for the recent spike.
We suspect that this variant is already in Nigeria. It will be surprising if it is not, but we simply don't know yet. So what we are doing are collecting samples of recently diagnosed cases and working to do the sequencing that we need to do in order to verify if this variant exists in Nigeria or not.
The government has now placed tighter restrictions on passengers flying into the country from the UK and South Africa, which has detected separate variant of the virus. It also reinstated some of the earlier restrictions it lifted.
The other challenge that we're facing, apart from the challenge of the outbreak, is an increasing outbreak of misinformation. Every day we receive broadcast messages on WhatsApp, people sending forth messages that are unsubstantiated and in fact wrong.
With the increasing number of infections, the government has ordered the reopening of isolation centers. The commercial capital Lagos is the epicenter of the outbreak in the country. Authorities here are increasing testing capacity and setting up oxygen sample sites for patients with severe cases.
An oxygen sample site is a permanent structure, and there are 10 of them across Lagos. So if you can't get to one of our isolation centers and you need oxygen, all you need to do is go to one of these centers and you can be managed there. We give you enough oxygen till you calm down. We start some treatment before we transfer you to an isolation center.
A COVID-19 vaccine is expected in January. In the meantime, the government is appealing to the public to comply with preventive measures.